dietary changes. Making positive lifestyle changes can significantly impact your fertility. Maintain a healthy weight, exercise regularly, and consume a balanced diet rich in vitamins, minerals, and antioxidants. Reducing stress through activities like yoga or meditation can also be beneficial. Step 4. Medications and hormonal therapy. In some cases, hormonal imbalances may be causing infertility. Your specialist might prescribe medications to regulate your hormones and improve your chances of conception. Step 5. Assisted reproductive technologies ART. When other methods aren't successful, you may explore assisted reproductive technologies such as IVF. This involves fertilizing eggs with sperm in a laboratory and transferring the resulting embryos into the uterus. Step 6. Egg or sperm donation. If needed, you may consider using donated eggs or sperm. This option is often chosen when a partner has low-quality eggs or sperm or in cases of same-sex couples. Step 7. Surrogacy. Surrogacy is another option for individuals or couples who can't carry a pregnancy themselves. A surrogate mother carries the pregnancy on behalf of the intended parents. Step 8. Adoption. If achieving a biological pregnancy isn't possible, adoption is a wonderful way to build a family. Adoption agencies can help match you with a child, and the process varies by country and jurisdiction. Step 9. Emotional support. Throughout this journey, emotional support is essential. Consider joining support groups, seeking therapy, or confiding in close friends and family members who can provide comfort and understanding. Step 10. Patience and persistence. Remember, the path from infertility to fertility can be challenging, but staying patient and persistent is key. Celebrate small victories, lean on your support network, and never lose hope. Conclusion. Host, that wraps up our step-by-step guide on transitioning from infertility to fertility. We hope you found this information helpful and encouraging. If you have any questions or would like us to cover specific topics in the future, please leave a comment below. Don't forget to give this video a thumbs up and share it with anyone who might benefit. Thank you for watching, and we'll see you in the next video. Stay strong and keep believing in the
10 Best Foods for Boosting Fertility in Women. Introduction. Greet your audience and introduce the topic. Mention the importance of nutrition in fertility. Point 1. Fruits and vegetables. Highlight the benefits of vitamins, minerals, and antioxidants. Provide examples of fertility-friendly fruits and vegetables. Point 2. Leafy greens. Emphasize the role of folate in reproductive health. Recommend specific leafy greens like spinach and kale. Point 3. Whole grains. Discuss the benefits of complex carbohydrates and essential nutrients. Suggest whole grains such as quinoa, brown rice, and oats. Point 4. Lean proteins. Explain the importance of protein without excess saturated fats. Recommend sources like poultry, fish, and plant-based proteins. Point 5. Nuts and seeds. Highlight the nutritional value of healthy fats, protein, and minerals. Name specific nuts and seeds beneficial for fertility. Point 6. Fatty fish. Discuss the role of omega-3 fatty acids in promoting fertility. Recommend fish options like salmon, mackerel, or sardines. Point 7. Dairy or alternatives. Stress the significance of calcium and vitamin D for reproductive health. Suggest dairy products or alternatives like fortified plant-based milk. Point 8. Avocado. Talk about the benefits of monounsaturated fats and folate in avocados. Provide creative ways to incorporate avocados into the diet. Point 9. Berries. Discuss the antioxidant-rich nature of berries. Name specific berries like blueberries and strawberries. Point 10. Water. Explain the importance of staying hydrated for overall health and fertility. Encourage viewers to prioritize water intake. Conclusion. Summarize key points. Invite viewers to share their thoughts or ask questions in the comments. Remember to engage your audience, maintain a conversational tone, and include any additional information or personal anecdotes that can enhance the video.
Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer. Emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action. Ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information.
Teen pregnancy can have significant physical and emotional health risks for both the mother and the baby. Teenage mothers are at a higher risk of experiencing complications during pregnancy and childbirth, such as premature birth, low birth weight, and preeclampsia. These complications can have long-term health effects for both the mother and the baby, such as developmental delays, chronic health conditions, and even death. Furthermore, teenage mothers may experience emotional and mental health issues during and after pregnancy. It's important to educate young people about safe sex practices and contraception to prevent unintended pregnancies. Providing comprehensive sex education that includes information about contraception and healthy relationships can help young people make informed decisions about their sexual health. It's also important to provide access to affordable and effective contraception options for teens who choose to be sexually active. Teen pregnancy can have significant physical and emotional health risks, but with education and resources, we can help prevent unintended pregnancies and support pregnant teens in maintaining their health. Thanks for watching. Don't forget to like and subscribe for more videos like this.
lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance, while excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for optimal fertility. Point 4. Avoid harmful substances. Smoking can decrease fertility in both men and women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine intake has been linked to reduced fertility, so consider cutting back. Point 5. Preconception health check. Before embarking on your pregnancy journey, schedule a thorough health checkup with your doctor. Discuss any pre-existing conditions, medications, or supplements you're taking that could impact fertility. Point 6. Stay hydrated. Drinking enough water helps maintain healthy cervical mucus, which plays a role in fertility. Point 7. Timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8. Communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. If you're having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion. Thank you so much for joining us today as we explored these comprehensive tips for increasing your chances of getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content. Hello everyone, welcome back to our channel. Today, we are going to discuss the early signs of labor that expectant mothers should be aware of. If you're new here, consider subscribing and hit that notification bell so you won't miss any updates. Let us get started. The first sign is lightening. This occurs when the baby drops lower into the pelvis, relieving pressure on the diaphragm. Moms-to-be might feel increased pelvic pressure and notice their baby bump is lower. Braxton Hicks contractions. Next up, Braxton Hicks contractions. These are irregular, painless contractions that help prepare the uterus for labor. They may feel like a tightening or hardening of the belly. Increased discharge. As labor approaches, you might experience increased vaginal discharge. This is known as the mucus plug, and it protects the cervix during pregnancy. Losing it is a sign that labor could be near. Nesting instinct. Feeling an uncontrollable urge to clean and organize. That's the nesting instinct kicking in. Many expectant mothers experience this surge of energy right before labor. Diarrhea or nausea. Hormonal changes can lead to gastrointestinal changes too. Diarrhea or nausea might occur as your body prepares for labor. Back pain. Persistent lower back pain can be a sign of labor, as the baby's head presses down on the pelvis and sacrum. Rupture of membranes. When the amniotic sac ruptures, commonly known as the water breaking, it's a clear indication that labor is imminent. This might be a gush of fluid or a slow trickle. Contractions. Last but not least, true labor contractions. These are regular, progressively intensifying contractions that help the cervix dilate and efface. Conclusion. Remember, every pregnancy is different, and not all women will experience these signs in the same way or order. If you notice any of these signs or have concerns, always reach out to your healthcare provider. Stay tuned for more pregnancy-related content and take care. See you in the next video. Outro. Thank you for watching. If you found this video helpful, give it a thumbs up and share it with others. Don't forget to subscribe and hit the notification bell to be notified of our future videos. Stay safe and take care. Bye.
The effects of teenage pregnancy, 20 key points. 1. Introduction. Hello everyone, welcome back to our channel. Today, we're diving into a crucial topic, the effects of teenage pregnancy. 2. Higher health risks. Teenage mothers often face higher health risks during pregnancy compared to older women. 3. Educational challenges. Teen moms are more likely to drop out of school, limiting their educational and career opportunities. 4. Economic impact. Teenage pregnancy can contribute to financial strain on families and communities. 5. Emotional stress. Young parents may experience heightened emotional stress due to the challenges of parenthood at an early age. 6. Impact on mental health. Teenage mothers are at a higher risk of experiencing mental health issues such as depression and anxiety. 7. Social stigma. Teen moms often face social stigma and judgment from peers and the community. 8. Parenting skills. Being a parent requires skills that young individuals might not have fully developed, impacting effective parenting. 9. Relationship strain. Teenage pregnancies can strain relationships, leading to higher rates of breakups. 10. Limited social life. Young parents may find it challenging to maintain an active social life due to parenting responsibilities. 11. Child development. Children born to teenage parents may face developmental challenges. 12. Single parenthood. Teenage pregnancies often lead to single parenthood, which can be challenging for both the parent and child. 13. Healthcare access. Access to proper healthcare may be compromised, affecting both maternal and child health. 14. Generational cycle. Teenage pregnancy can perpetuate a cycle, as children of teen moms may be more likely to become teen parents themselves. 15. Limited career opportunities. Teen moms often face difficulties pursuing and maintaining careers, impacting their financial independence. 16. Child poverty. Children of teenage parents are at a higher risk of living in poverty. 17. Higher rates of preterm births. Teenage pregnancies are associated with higher rates of preterm births, affecting the baby's health. 18. Child abuse. Risk. Teen parents may be at a higher risk of unintentional child abuse due to lack of experience and stress. 19. Impact on educational goals. Teen moms may struggle to achieve their educational goals, limiting their potential in various fields. 20. Prevention and support. It's crucial to focus on prevention and provide support systems to help reduce the impact of teenage pregnancy on individuals and society. Closing. Thanks for joining us today. If you found this video informative, don't forget to like, share, and subscribe. Let's continue the conversation in the comments below. Until next time, stay informed.
Hello and welcome to our video on pregnancy workout. Being pregnant can be a beautiful and special time, but it can also come with its own set of physical challenges. In this video, we'll be talking about the benefits of staying active during pregnancy, as well as the potential risks to be aware of. Whether you're a first-time mom or a seasoned pro, this video will give you the information you need to make informed choices about your pregnancy workout routine. The advantages of pregnancy workout. Regular exercise can help you maintain a healthy weight, reduce the risk of gestational diabetes, and improve your mood. It can also prepare your body for labor and delivery, and help you bounce back more quickly after giving birth. Additionally, staying active during pregnancy can have long-term benefits for both you and your child. Studies have shown that children of active mothers are more likely to be active themselves, and have a lower risk of obesity and other health problems. Regular exercise during pregnancy can also help improve sleep, increase energy, and improve overall well-being. The importance of safety. It's essential to consult with your doctor before starting a new exercise program, especially if you have any pre-existing health conditions. Avoid activities that have a high risk of falling or injury, such as contact sports or downhill skiing. Listen to your body and make adjustments to your workout routine as needed. It's also important to stay hydrated, eat a healthy diet, and get enough rest. Modifying your workout. In the first trimester, you may be able to continue with your regular exercise routine, but as your body changes, you'll need to adapt. Reduce the intensity of your workout or avoid certain exercises as your pregnancy progresses. Prenatal yoga or water aerobics are both safe and effective ways to stay active during pregnancy. Prenatal Pilates and strength training are also great options to consider, as long as you are working with a trained professional who understands the modifications needed for pregnancy. The disadvantages of pregnancy workout. Some women may experience fatigue and morning sickness during the first trimester, which can make it difficult to maintain a regular exercise routine. As the pregnancy progresses and your body changes, certain exercises may become more difficult or uncomfortable. Some women may experience gestational hypertension or preeclampsia, and in such cases, the doctor may advise to stop exercising. In conclusion, staying active during pregnancy can be beneficial for both you and your baby, but it's important to consult with your doctor, listen to your body and make necessary adjustments. Regular exercise can help you maintain a healthy weight, reduce the risk of gestational diabetes, and improve your mood, but it is essential to stay safe and avoid activities that have a high risk of falling or injury.
"10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms to be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Step-by-step guide to in vitro fertilization, IVF. How IVF works. 1. Introduction. Welcome to our step-by-step guide to in vitro fertilization, or IVF, the groundbreaking process that's helped countless families realize their dreams of parenthood. 2. Step 1. Fertility medications. The journey begins with fertility medications, typically administered as shots. These medications stimulate your ovaries to produce multiple mature eggs. The goal, to harvest 10-15 eggs, a process that typically takes about 2 weeks until your eggs are ready for retrieval. 3. Step 2. Egg retrieval. Next up is the egg retrieval process, a brief procedure lasting 15 to 30 minutes. During retrieval, a doctor utilizes ultrasound guidance to insert a thin, hollow tube through your vagina and into the ovary containing the eggs. A suction device connected to a needle gently retrieves the eggs from each follicle. 4. Step 3. Fertilization. Now, it's time for fertilization, a critical stage in the IVF process. In traditional IVF, eggs and sperm are left in a laboratory dish to fertilize naturally. Alternatively, in intracytoplasmic sperm injection, ICSI, a single sperm is directly injected into the egg for fertilization. This method bypasses natural barriers, increasing the likelihood of successful fertilization. 5. Step 4. Embryo development. Once fertilization occurs, the embryo begins to divide its cells, eventually reaching the blastocyst stage, 5-6 days post-fertilization. At this stage, multiple embryos are carefully selected for transfer back into your uterus. 6. Step 5. Embryo transfer. The final step, embryo transfer. Multiple embryos are transferred back into your uterus with the hope that at least one will successfully implant and begin to develop. 7. Conclusion. And there you have it, a comprehensive overview of the IVF process, from fertility medications to embryo transfer. If you're considering IVF or simply curious about the procedure, don't hesitate to reach out to a qualified fertility specialist. Thanks for joining us, and we wish you all the best on your journey to parenthood.
Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe. Hello, expecting moms. Congratulations on reaching the 3rd trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion: congratulations, you've completed a safe and effective pregnancy workout for the 3rd trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing.
11 weeks pregnant, your baby's development. From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to rule out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it, he is moving, waving and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth. Early pregnancy symptoms at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy, greasier, spotty skin, thicker and shinier hair, bloating and the feeling of being bloated.
14 weeks pregnant. Your baby's development. Welcome to your second trimester. Your little one is trying out some new moves this week. Your baby's eyes are starting to move, and those little legs and arms are starting to flex. These movements also allow your baby to practice the important skill of moving hands to mouth. The senses of smell and taste are also developing, and your baby's skin is thickening too. You'll have to wait and see if your baby will be born with a full head of hair or not, but right now, hair follicles are forming under the surface of the skin. With each passing week, your baby is looking more and more like the little person you'll meet the day you give birth. By now, or very soon, the genitals are fully developed. But it's still too early to know whether you're having a boy or a girl. How big is my baby at 14 weeks? At 14 weeks, your baby is growing and developing rapidly, measuring between 3.5 and 4 inches long and weighing around 2 ounces, about the size of a navel orange. The size of the fetus at 14 weeks pregnant. At 14 weeks, the fetus is roughly the size of a nectarine. Around this time, the average fetus weighs about 1.5 ounces and can measure up to 3.5 inches long, crown to rump. Making faces. Thanks to brain impulses, your baby's facial muscles are getting a workout. Those tiny features can squint, frown, and grimace. Your baby is also making sucking and chewing movements. Growing hair. Soft baby hair is coming. Hair follicles have started to form deep in your baby's skin. Around 20 weeks, fine downy hair will sprout from these follicles on your baby's eyebrows, upper lip, and chin. Your active baby. Though you can't feel those tiny punches and kicks yet, your baby is quite active and has flexible hands and feet. Mom's body at 14 weeks pregnant. You've finally reached the second trimester. Pregnancy symptoms during week 14. No more morning sickness? Your energy is likely returning, and your queasiness may have eased by now. If not, hang on, chances are good that morning sickness will soon be behind you if it's not already. Although it's uncommon, some expecting moms will still feel nauseated months from now. Tell your healthcare provider at your next appointment if you're still having nausea or vomiting. Starting to show. The top of your uterus is a bit above your pubic bone, which may be enough to push your tummy out a tad. Starting to show can be quite a thrill, giving you and your partner visible evidence of the baby you're waiting for. Bleeding gums. About half of pregnant women have swollen, red, tender gums that bleed when flossed or brushed. This gum inflammation, called pregnancy gingivitis, is partly caused by hormonal changes that make your gums more sensitive to the bacteria in plaque. Be sure to brush your teeth twice daily, and floss daily. Round ligament pain. On either side of your uterus, you have 2 ligaments that stretch and thicken to accommodate your growing belly. These changes may cause round ligament pain. It can feel like a short, stabbing pain in response to movement, or a dull ache after an especially active day. If round ligament pain strikes, try to stop and rest, pay attention to your posture, change positions, gently massage the area, or take a warm bath. Some women find that wearing a maternity belt for extra support helps relieve the pain. Increased appetite. Pregnancy hunger starts and peaks in the second trimester. Your body is working hard to support your baby, and that requires plenty of energy. Your meals are also fueling your body's pregnancy changes, which include a much higher blood volume, your growing breasts and uterus, and increased fat stores. You need an extra 300 to 350 calories per day in the second trimester. Round ligament pain. For some women, a possible side effect of uterine growth is what your OB/GYN would call round ligament pain. Basically, these are pregnancy growing pains that feel like achy or sharp pains on one or both sides of the abdomen. That begin to appear around 14 weeks but can strike at any time during the second trimester. Here's why. The uterus is supported by thick bands of ligaments that run from the groin up the side of the abdomen. As your uterus grows, the supporting ligaments stretch and thin out to accommodate the increasing weight. This weight pulls on the ligaments and causes a sharp pain or a dull ache in your lower abdomen. It's often more noticeable when you change positions suddenly or quickly get up from sitting or lying down, or when you cough or sneeze. The best way to bring relief? Put your feet up and rest in a comfortable position, which should ease the strain and the pain. Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of one chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever. A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. This will help you avoid excessive weight gain. Stay safe. Although it's advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during pregnancy have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches. This is known as cloasma or the mask of pregnancy. Greasier, spotty skin, thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell, mood swings, a white milky pregnancy discharge from your vagina and light spotting. Seek medical advice for any bleeding.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin. It's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, Take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
17 weeks baby development. How big is your baby at 17 weeks pregnant? The baby is around 5.1 inches this stage. This is roughly the size of a potato. The skin is loose and wrinkled and the fetus has a lot of growing to do. By the time of the delivery, he or she will fill out their skin more normally. Around this stage of pregnancy, the fetus starts to look a lot more human. In addition to hair growing on the head, the eyebrows and eyelashes are also developing. The eyelids are shut, but the eyes themselves can move and the mouth can also open and close. The fingernails and toenails are growing, and your bundle of joy has also developed a firm grip. Your baby's been getting bigger and bigger over the last couple of weeks, and this means that he or she has needed a larger placenta. Remember that the placenta is the organ that supplies nutrition to the fetus, removes waste products, and fulfills other important roles. By the end of your pregnancy, the placenta will weigh around 510 grams. Your baby now has doubled in weight in the last 2 weeks. Fat begins to form, helping your baby's heat production and metabolism. The lungs are beginning to exhale amniotic fluid, and the circulatory and urinary systems are working. Your baby's bones. Your baby's skeleton is changing from soft cartilage to bone. Support your baby's bone health, and your own, by eating calcium-rich foods. Getting enough calcium also reduces your risk of hypertension and preeclampsia. The umbilical cord. The umbilical cord, your baby's lifeline to the placenta, is growing stronger and thicker. By the end of pregnancy, it will be approximately 9 inches long and an inch thick. The umbilical cord delivers nutrients to your baby and ferries away waste products. Your baby's skin. Sweat glands are starting to develop. And by next week, the layers of your baby's skin will be fully formed. Your baby when you're 17 weeks pregnant. Your baby is getting bigger all the time and might now weigh more than the placenta. Your baby is about 13 centimeters from head to bottom and about 150 grams. Your baby's external sex organs are completely formed. The kidneys are working, and your baby passes urine every 50 minutes or so. Your baby will also swallow some urine, which is sterile, in the amniotic fluid. This is normal. Loud noises might make your baby startle. Your baby's taste buds are working, and your baby can tell the difference between sweet and bitter. What does my baby look like? Your baby, or fetus, is around 12 centimeters long, from head to bottom, and weighs around 150 grams. That's roughly the size of a pomegranate and the weight of a ball of mozzarella. Your baby can move their eyes, although they'll stay shut for now. React to loud noises, open and close their mouth. Your baby's fingernails are starting to grow and will have their own unique fingerprints. Even identical twins have different fingerprints. Week 17, your second trimester. You might be moved now. You will not be able to tell exactly what your baby's up to, but soon you could be feeling every kick, punch, hiccup and somersault. Your baby's movements. Many women spot the first signs of their baby moving between 18 and 24 weeks. Inside your tummy, you might feel bubbling, fluttering, rolling. You might find that your baby moves more after meals, when you listen to loud music, when you rub your tummy and talk to your baby, when you are relaxing. Here are some of the other symptoms you may be experiencing: tiredness and difficulty sleeping, swollen or bleeding gums, pain on the side of your belly, headaches, nosebleeds, bloating or constipation, indigestion. Baby development at 18 weeks pregnancy. At 18 weeks of pregnancy, your baby is developing at an incredible rate. During this stage of pregnancy, the baby's body is becoming more proportional, and the organs are maturing. The baby's bones are solidifying, and the baby is beginning to practice making facial expressions. The baby is now able to move in a more coordinated fashion. The baby is able to stretch, kick, and move its arms and legs. It may even be able to respond to external sounds and pressure, such as music or when you press on your abdomen. The baby's senses are developing at this stage of pregnancy as well. The baby's eyes are beginning to open and can detect light. The ears are also opening and allowing the baby to hear sounds from outside the womb. The baby has also developed taste buds and can now distinguish between sweet and sour flavors. The baby is beginning to produce surfactant, a substance that enables the lungs to expand and contract. This will eventually allow the baby to breathe on its own. The baby's hair, nails, and lanugo, the fine hair that covers the baby's body, are also developing. At 18 weeks, your baby is growing rapidly and developing new skills. Although it may be difficult to imagine, your baby is quickly becoming more and more like a newborn. As your baby continues to grow, you will be able to feel more and more of its movements inside your womb. By the end of this stage of pregnancy, you will be able to feel your baby's kicks, punches, and hiccups. Hello and welcome to our video on 19 weeks of pregnancy symptom and baby development. Congratulations on making it to the halfway point of your pregnancy. This is an exciting time as your baby continues to grow and develop, and you start to feel more and more like a mom-to-be. In this video, we'll cover what's happening with your baby and your body during the 19th week of pregnancy. Let's start with your baby's development. At 19 weeks, your baby is the size of a mango, measuring about 6 inches long and weighing around 8.5 ounces. This week, your baby's skin is getting thicker and more opaque, and you may even be able to see tiny veins underneath. Your baby's ears are also fully formed, and they can now hear your voice and other sounds from outside the womb. Your baby's brain is developing rapidly, and the neurons in their brain are now forming more complex connections. This means that your baby's movements are becoming more coordinated, and they may even start to play with their umbilical cord. Your baby is also starting to develop more defined facial features, including eyebrows and eyelashes. Now, let's talk about the symptoms you may be experiencing at 19 weeks pregnant. By this point, many of the early pregnancy symptoms have subsided, and you may be feeling more like yourself again. However, you may still be experiencing some common symptoms such as Braxton Hicks contractions. You may start to feel mild contractions in your uterus as early as the second trimester. These contractions are completely normal and help to prepare your body for labor. Increased appetite. You may find that you're hungrier than usual, especially as your baby's growth requires more energy. Back pain. As your baby grows and your belly expands, you may start to experience back pain. This is due to the extra weight you're carrying and the changes in your posture. Swollen feet and ankles. You may notice that your feet and ankles are starting to swell, especially if you've been standing or sitting for long periods of time. To reduce swelling, try elevating your feet